People often think that ADHD and perfectionism are opposites. So ADHD involves being late for things, making careless mistakes because you're not paying attention to details, missing social cues and intruding people's social space or cutting people off. And perfectionism is about being perfect. Aren't those opposite? Perfectionism is associated with a lot of mental health issues, depression, anxiety, suicidality, eating disorders, obsessive traits, narcissistic personality disorder, and ADHD itself. Why is that? Some of it might be genetics. So there are genetic contributions both to ADHD and to perfectionism. And we know these are polygenic, which means hundreds of genes contribute each a tiny bit. So there are some genes in common contributing to both conditions. But a lot of it's probably due to social programming in our environment. And people with ADHD from an early age, because they're doing things differently in a neurodivergent way, tend to be criticized more often. People call them out on their faults or problems. And we know that having hypercritical adults around you is one contributing factor to developing perfectionism as a counter strategy, either to create a sense within the self that I need to be good or perfect so I don't get criticized, or more explicitly, I need to not make mistakes in front of these other people so they won't see me as defective or bad. And some people feel that perfectionism is a personality trait and therefore that can't change over time, particularly if there's some genetic contribution. We know there's a host of cognitive and behavioral approaches, therapy approaches that can change perfectionism and learning to reframe things and learning to be more flexible in your thinking.